Hello and welcome to this Health Foundation webinar on putting people and communities at the heart of health and wellbeing. I'm delighted to be here with you today, and it's great to see that so many of you have joined this session. I'm Sarah Henderson, Associate Director of Improvement Programmes at the Health Foundation, and will be chairing this afternoon's session. Also with me are Catherine Zollman, Clinical Lead at Braun UK, Sundra Singham, also from Braun UK and an expert by experience, Phil Walters, Strategic Lead at Creative Minds, and Debs Taylor, who's a Peer Project Support Officer at Creative Minds and also an expert by experience. And this webinar is really an opportunity for us to share findings from the Realising the Value programme, which we've been jointly leading with Nesta over the last 18 months. And I'll start with a brief overview of this work and some of our findings from the programme before handing over to the others to hear their perspective as partner sites and also their own personal experiences. Please do submit any questions as they come to you throughout the course of the presentations. There should be a box on the left-hand side of your webinar screen that you can just type them in and they'll come straight through to us, so we can be prepared to ask them at the end of the session. Now, Realising the Value was commissioned by NHS England, and it was really designed to better understand the evidence for person and community-centred approaches and how these can be implemented in ways that benefit individuals, the health and social care system, but also wider society. It really aimed to bring alive Chapter 2 of the 5-year forward view, which talked about tapping into the renewable energy of people and communities. And the Health Foundation and Nesta, along with our other consortium partners that you can see on this slide, built a programme of work around that to try and answer that question and really support people and communities to be partners in their health. Now, the programme produced a large number of outputs, and this is a busy slide, but you can hopefully see the range of work we did, everything from a review of the evidence around person and community-centred care, to a practical economic modelling toolkit for commissioners to build their local business cases, to looking at behavioural insights and culture change. But today we're going to focus on the practical learning from our partner sites and hear both from those implementing the approaches and also from those who've benefited from experiencing them. Now, all of these resources are available on the Realising the Value website and also the Health Foundation website. And there should also be a link to it on the resources tab of your webinar screen. So when you've got some time to have a look through them, please do visit that page, and hopefully there'll be something of interest to everyone. But just a sort of quick overview of what we mean by person and community-centred approaches, because it is an umbrella term that includes lots and lots of different ways of doing things and different approaches. And this slide just shows that some of them can be quite closely related to formal healthcare and formal healthcare settings, and others can be really embedded in the community and not at all to do with formal health services. What they've all got in common is thinking about the strengths of people rather than dealing with the problems facing people at that moment. Now, this is a really quick visual snapshot that I won't dwell on, but just shows how people might experience person and community-centred approaches within their care or within their world more broadly. And this just really shows sort of what best practice is, and it's wonderful that this best practice does exist, and you'll hear from some of that today. But the challenge to Realising the Value was how to make that more widespread and turn it into something that was the experience of everyone rather than just sort of the lucky few. And one of the ways that we tried to explore this was working with partner sites to understand how they had been successful locally in embedding this way of working. And this slide just shows the 5 different approaches that we focused on, along with the partner sites that we worked with. And really important to say that these 5 approaches are not mutually exclusive. There's lots of overlap between them, and also that they're not the only approaches out there, and certainly not the only ones that we would suggest that you look into. However, we chose these because they gave us a good opportunity to explore in detail different approaches with some like peer support, which can be quite closely related to health services, and others like the asset-based approaches, which really are community initiatives and about as far away from health services as I think you could imagine. And as I mentioned at the beginning, we're lucky enough to have representatives from two of our partner sites here today, Penny Braun and Creative Minds, who are really going to give us some more in-depth detail about self-management education and group activities to promote health and well-being. So I'm going to hand over to Dr. Catherine Zollman from Penny Braun now, who will provide some more information about Penny Braun and the great work that you're doing there.
Thank you very much, Sarah. And Penny Braun were delighted to be chosen to take part in the Realising the Value project, focusing on the self-management education courses that we run and interventions that we offer. Penny Braun, as a charity, was founded in 1980 by Pat Pilkington and Penny Braun, who herself was a person with experience of cancer. We're lucky enough to be able to offer our services from purpose-built premises just outside Bristol, where we can offer day services and residential courses. And all the services that we offer have been freely available to anybody affected by cancer since 2010. Now, when Penny was diagnosed with breast cancer in the mid to late 70s, she found that the care that she received at that time really failed to meet her needs in a number of important areas. And it failed, very importantly, to treat her as a whole person capable of playing a part in her own cancer journey and her own sort of path to living well and living as well as she could for as long as she could. So with her friend, she explored an awful lot of the options that were available elsewhere in the world, travelling extensively in Europe, and brought back what she'd learnt to set up something that would give people an opportunity to become actively engaged. This is what she wrote in 1987, and I think you can see that we feel she was quite a visionary, really. She said, if we shift the responsibility for health so that it's no longer exclusively in the doctor's hands, but we allow the patient to play a part as well, we go a long way towards relieving feelings of helplessness and futility. And giving people back a sense of hope and a sense of control over what's going on for them and what they're experiencing is a recurrent theme that we kind of hear back from a lot of the people who use our services. That cancer somehow feels like at certain times all the control's been taken away from you, and that people are often put in a passive role. Whereas at Penny Braun, we really have learnt by experience and by involving service users and people affected by cancer, as well as wider stakeholders, that there's an awful lot that can be done. So the Penny Braun whole life approach has really been developed by doctors, by nurses, by complementary therapists, with a huge amount of input from people with cancer and their supporters to work alongside medical treatment and to give people practical tools to help them live well with cancer. We base our interventions around this idea that people are more than just a physical body. Their mind, emotions and spirit as well, which all play an important part in how they experience cancer, and very importantly in what they can do to help themselves stay well and be as resilient as they can to respond to the challenges. And they're not just an isolated person, they exist in relationships, in communities, they live in places, and they have practical issues to deal with that also have a bigger, wider impact. So we really call the basket of services and interventions that we offer the Penny Braun whole life approach. And we help people see that their needs are really at the centre of all our service developments and of the things that they can choose from to make a difference to them. And really importantly, we recognise that people affected by cancer are not just the ones with the cancer diagnosis themselves. Supporters, friends, families, people within the close circle of support are also hugely impacted by a diagnosis of cancer. So all our services are just as open and available to people in that supporting role as they are to the person with cancer themselves. And firstly, we talk about helping people holistically assess what their needs might be. And the first step is really recognising that cancer affects the whole person. And this is a very wordy slide, but you can see some of the areas in which, alongside the physical symptoms of the cancer or the side effects of the cancer treatment, cancer may have an impact. So it can affect your thoughts and the way that you think. It can affect your emotions and the way you might process things. It can affect the very core of kind of what makes you who you are. The things that give meaning and purpose to your life can suddenly feel like the carpet's been taken away. So first of all, there is that sort of acknowledgement and helping people kind of map what's important to them. What are the things that need addressing, and how can they play a role in starting with support to move forwards in those different areas. So once we've acknowledged the impact and we've identified the most pressing needs, we can then help people begin to learn about the things that will actually help them build their resilience in those different areas. And sometimes it's a question of building resilience in a number of different ways to help people live as well as possible and maximise the impact of any activities that they do. So this idea about activating people, giving them the confidence, giving them the skills, and giving them, very importantly, the support that they need to make those little changes that can make all the difference. So here are some things that can make a difference, and this is a slide that's got, again, a really busy slide. We often use this with people who come and use our services, and we call it the busy slide, but the idea is really not that people feel overwhelmed with, oh my goodness, now I need to do all these different things, but that they have a menu of things to pick from, and that they can start to identify the things that might be possible, practical, important and meaningful for them in these different areas. And often we find that something might hit a number of different areas. It might be something that's physically very good for you. Taking a walk in nature might be great for physical exercise, but it also may calm your emotions and help you think more clearly. So there can be things that affect you on a number of different levels in a positive way. And we encourage people to pick the low-hanging fruit, pick the things that they're going to enjoy the most and that they think will give them the quickest benefits. And these are some of the things that we offer at our National Centre, and we also have a range of self-management education programmes that we offer outside our centre in 4 regions around the UK, in the north, in the West Midlands, in London and the South East, and in the South West as well. So people can learn about ways to keep physically active at a level that suits them and suits the point in the cancer journey where they are at that time. And those can be a number of different things, from yoga to Nordic walking to Tai Chi to dancing and to more sort of gym-based cancer rehabilitation. And we signpost people to local services that might be appropriate for them. We also very actively encourage people to look at what they're eating and how they're nourishing their bodies. Often through cancer treatment, digestion and appetite and weight can change, and we focus very much on how people can restore themselves with learning about the foods that support their health and learning about ways in which they can enjoy their meals and enjoy the social interaction that healthy eating can give. And we very importantly help people connect themselves with the activities that can help enhance the connection between their mind and their body. So some people find benefit from counselling, some people need to learn skills to help them relax more effectively and help them switch off stress responses and switch on relaxation responses. For some people, words aren't so important, and music and art and imagery can help. And very importantly, many of our services happen in a group setting where people can access other people in similar situations and get an awful lot of support from their peers. So those are just a selection of things that we offer, and we help people and support them into some of those activities, encouraging people to try things for the first time if they've never tried them before. There's no sense in which there's a set sort of menu. People pick and choose, and maybe trial and error, maybe they'll try something which they don't get on with that well to begin with, and then that will give them a bit more information about the sorts of things that can help. So really what we're focusing on doing in cancer care is promoting the idea of self-management. For so long now, cancer and cancer treatment has felt like it's the domain not just of the medical profession, but really even the secondary healthcare system. So hospitals, not even GPs feel competent maybe to have conversations about how people can help themselves in a cancer setting. So we really are trying to change the conversation from what's going to happen to me, which puts someone in a very passive situation where they're no longer in the driving seat, to what can I do to help myself, and to pick from a range of evidence-based approaches which have powerful impacts on recurrence rates, survival rates, and overall quality of life, so that they can really carry on and self-manage and play an active part alongside their medical treatment in a way that works together, so that they're really effectively getting the best of both worlds. And I think what we find is that many people come to us initially driven by fear of dying, and that's a very strong and powerful motivator. But as they start to engage, maybe for the first time in their lives, in active self-management, not just of their cancer, but of their overall health, well-being and resilience, they start to tap into something much more sustainable and something much more long-term motivating and much more life-enhancing, which is this idea about joy of living. And when people find activities that really do support their own health and well-being, it becomes a virtuous cycle, and they start enjoying it, their friends start noticing the difference, and communities build. So it really spills out just from that one individual into a much wider, healthier pattern of becoming an active participant in one's own health creation. So thinking about the kind of practical things that we might, as a centre who's been involved in this kind of work for 35 years now, what are the things that we found over the years that have made a difference and that have helped us hone our services and make them more effective? And we've done this very much in partnership with the people who use our services. All our services are evaluated, and we always give people opportunities to give us verbal, written and sort of spoken feedback. And we've got a very active community group of service users who give us feedback all the time. So firstly, I think it's really important to use individual holistic assessment so that people can set their own goals in a way that meets their needs and that are meaningful for them. So this idea of helping people map their resilience and map their overall health and well-being in those different areas. How are they doing mentally? How are they doing physically? How are they looking after themselves emotionally? How are they in their spirits? Those things we talk about very early when people engage with our services. We try and get a picture, a snapshot of how they are, and encourage people to keep sort of dipping in and checking in with themselves as time goes on. We very much believe that people make the most important sort of steps forward when the things that they're engaged in link them to their overall aspirations and their fundamental sort of beliefs and underlying sort of preferences. So if you're helping people self-manage, find something that they already have a sort of leaning towards, or that they're excited about, or that fits with the bigger view of where they want to get to in their lives. And build in flexibility, because people can't engage with everything all at once. Some people have very many different learning styles and different ways of wanting to approach things. Sometimes people's energy levels may be very restricted and they may only have capacity to do one small thing. So our services and our programmes have been organised to reflect a real range. People can come just for an hour, or they can come for a 15-hour course, or they can come and stay for 2 or 3 days. So there's got to be that flexibility of approach and access. And the support has got to be ongoing, because people have different needs at different stages and sometimes hit a bit of a barrier. And we'll probably hear a bit more about some of those things, about the things that help people sustain this sort of way of moving forwards. But we feel once people are our clients, then they're our clients for life, and people come back, use our services, keep in contact by phone or by email. We have doctor's appointments, nutrition appointments that people can access one-to-one on the phone, via Skype sometimes. So we really try and help negotiate those ups and downs in the journey. And I think one really important message is that when you give people the sense that they have got some control over things and they have got some power, then it's quite easy sometimes for that to be turned back on themselves, and they say, well, if I've got the power and if the things I can do going forwards make a difference, was it my lifestyle or was it the way I was that made me get ill in the first place? And they can start to blame themselves or feel a burden of responsibility when maybe things don't go as well as they hope. And I think we very importantly, it's a thin knife edge often that people sort of dance on, but I think we really encourage people to say, we'll never know exactly why people get ill in the first place. There are many different factors that contribute, some of them absolutely nothing to do with anybody's control. And often one of the messages that I try and give people is that probably a third of what happens to us in our life is directly under our control. A third probably needs the help and support of somebody else and others around us, our teams, our doctors, our parents, the teachers who taught us at school. And probably a third is not under anybody's control. And so really what we're helping people do is do the best they can with what they can. So almost we can't change the cards we're dealt in life, but we can learn how to play them in the most intelligent and most helpful way for us. And all our services are evaluated, and I think that's really important for helping refine the service, but also help spread an understanding of the value of this. So it's much easier to motivate somebody to change if we can show them the results of previous people who've been part of the programme, who've made positive changes, who now are doing things that they never believed they would be able to do before, or whose quality of life or whose well-being has improved. Not only people using our services, but people funding and commissioning our services really need to see that evaluation data. And the evaluation really needs to be patient-centred and patient-focused so that it's meaningful, that it actually captures the information that we need it to capture. And I think be realistic as well. Every journey starts with a single step, and really helping people see that it doesn't need to be wholesale change, it doesn't need to be dramatic. Sometimes just one small thing can start that process of activation, can start that process of taking one little step closer to starting to feel more in control, and very quickly other steps can follow after that. So not to be put off if really your capacity feels very limited at the moment to making that first small step. And especially if we can help make it fun, and Penny Braun is a place where really there's more laughter than anything else. We really try and make the focus very one of sort of enjoyment and helping people find the tools in their toolbox that will really make it easy for them and fun for them to move forwards in their lives. So I think that's all I wanted to say, and maybe Sundra can help tell us a little bit about your experience of using the services.
Yeah, so my name's Sundra, and I was diagnosed with ovarian cancer just over a year ago now. It came completely out of the blue. It was an absolute shock to me because I'd always been very healthy, no family history of cancer at all. Yeah, I felt completely out of control, really. You know, I never really used the health services before. I suddenly found myself, you know, having surgery and actually also needing to learn and understand the medical language. I mean, you know, because my surgeon talked about my scan and said that my cyst was highly suspicious, but it didn't occur to me that highly suspicious meant that actually it's pretty certain that I did have cancer. I just wasn't until I woke up in the recovery room and I demanded of my registrant to know my diagnosis. So you're kind of having to adapt physically. You've got you know, surgery, chemotherapy, adapting to that, and also adapting actually to the psychological trauma of having a diagnosis, and the being completely out of control, as Catherine was saying. And for me, that not, you know, feeling so out of control was very, very difficult for me. And then finding myself trawling the internet to get information about what I could do to help myself, and all this conflicting information out there. Where do I go? Where do I go for evidence-based information that I could really rely on? You know, because I I don't understand medical language to sift through, you know, these research reports or whatever else. And so I remember somebody told me about Penny Braun, and then I went to one of the Living Well courses, and it was one of the first things I did very, very early on once I'd recovered from surgery, and I had just started chemotherapy. And quite frankly, it was a relief to be somewhere where I felt the information I was getting was reliable, a reliable source of information. It was a lovely, because it's a residential course, which felt really special to go there and kind of feel really taken care of. And that's really kind of important psychologically when you're just feeling everything's so tough, it feels really hard, and you know everything's out of control in your life. I think that also the residential then also meant you actually also had time to bond with other people, and that was really, really important, to share stories of kind of what you've been through with other people who really, you know, understand from their own experience, and that was very helpful. And all of that being held with a course which gave you information, but also time to reflect, time to share, and to make, you know, to make those steps, but in a way that was manageable for you, because, you know, as Catherine said, you're given a menu. You don't need, there's no pressure to do everything. And my tendency would always be to want to do everything, but kind of being really reassured that actually just take a few steps, do what you can, make them manageable, easy for yourself. And that was so helpful at that time, especially, and ongoing actually. Also things like, you know, we're told a lot about healthy eating, but there we experienced it. We experienced being able to try different foods and cooking in different ways that we might not have done. I'd never used coconut oil, for instance, before, and so I started to use that. You know, just messages which weren't just, you know, when there's only so much you can take in with lots of, you know, being given information, but actually experiencing it by being there, tasting the food, discussing it with other people, these new things, and having recipes, being given recipes, and the rationale, being given the rationale behind eating in a certain way, eating certain foods, as you know, was really, really helpful. I think, you know, as Catherine was saying, being given that the different domains of health, because I didn't really think about how my environment kind of impacted on me and my health. You know, and the spiritual dimension, which wasn't, you know, which isn't always kind of addressed, as well as, you know, your physical and your psychological. So it was a chance really to think holistically, you know, and to be more a full person, not just a cancer patient, which is often how it feels, and I did kind of have a feeling of, you know, being on the conveyor belt through your treatment, and here I was actually being able to do something more for myself, really, and to do that with other people, and to see that other people's journeys may be very different from mine, and they might want and need very different things, but there's also that commonality, and there's also that kind of support and bonding, which was, I mean, particularly helpful psychologically, I think. Yeah, so, and I think also one of the things I've really appreciated, a couple of things actually that I've really appreciated about Penny Braun since having done the courses. One is the follow-up around, you know, that you're given a follow-up phone call 6 weeks later just to find out how you're doing. Do you need any more support? You know, just to talk through what, you know, if you made any changes since then, and you know, if you didn't do so well on certain things, that was absolutely fine. You know, it's there for you just to get that support, and knowing, you know, so I have subsequently, you know, on occasion rung up and said, oh, I'm struggling with this, I just want to have a chat, you know, and it's that, so there's somebody there really to support that behaviour change, which actually isn't always so easy on your own. And I think another thing which has been, you know, for me has felt a real godsend, and that is, you know, because we do want to help ourselves more, and quite frankly, yeah, my whole digestive system, I'm still not right from chemo, and being able to, ring up and talk to somebody who is actually a doctor, a GP within the NHS, and to get that kind of information and advice on what, what probiotics or prebiotics, I should be having. I mean, there's so much on the market. So many different sources of information. Where do I go for reliable sources of information? I don't know. Those aren't available on the NHS. The NHS is great on, care and treatment, but not on, but not to get this additional information, which actually for me to be healthy and to recover, to make a good recovery, and I have made a good recovery, I think, through all these sources of help, is, all I can say, it's been amazing. And the other thing I also want to say is I think organisations like this also have really, I've also used Overcome, which is the ovarian cancer organisation, and Macmillan, as well as Penny Braun, just to ring up and talk through some of the symptoms or whatever else I might be having, so that when I actually go and see my consultant, I can actually, by that stage, I've got very clear on how to express what symptoms I have, what questions to ask, so that I can help him actually to help me better and take up less time. And for us to have a more efficient relationship, really. And that I'm really grateful for, and things like the online forum as well, which we had through Overcome Health Unlocked, where we exchange information, so things that might have been bugging me, with a scan coming up and all that kind of stuff. So yeah, just getting that additional support. Thank you.
That was wonderful. Thank you both, and really clear, description of how important self-management can be in recovery and diagnosis, and what a difference it can make. So thank you for that. We've got lots of great questions coming through, but please do keep sending them through. We'll come to them once Phil and Debs have told us a bit more about group activities.
Okay, thank you. My name's Phil Walters. I work for South West Yorkshire Partnership Foundation Trust. I actually run a small charity that's hosted by the Trust, so we're in quite an unusual position, I suppose. Our area, again, like Penny Braun, we were really honoured to be part of Realising the Value. Our area was providing group activities to improve health and well-being, but lots of similar kind of stuff, lots of crossovers between all the 5 partner sites, really. In terms of just who we are and where we sit, the Foundation Trust that we're hosted by covers Barnsley, Calderdale, Kirklees and Wakefield, and predominantly it's a mental health trust, but we do some physical health services as well. And I would say that our approach has worked just as well in physical health as it has in mental health, really. In terms of background and key themes, where this idea came from, and I suppose being hosted by an NHS organisation, we knew this was about culture change. This was about shifting the culture in the organisation. And by listening to people who were using our services at the time, they were saying to us constantly that creative activities would help us improve our health and well-being. So we talked to people, we talked to service users, carers, staff, and we came up with a co-produced strategy of how we might start to achieve that in the organisation. I would say a big factor in this is our chief exec at the time was very supportive of this approach, and our mission was moving away from a kind of more maintenance type approach to a more recovery focused service. So our mission was about supporting people to reach their full potential and live well in their community. And that in itself started the culture change that started the support for our approach, really. When we first engaged in some conversations, again, we were thinking that it was going to be more of an arts and health type project. But as we started talking to people, it was much more than that. So people were saying, well, sports helps, recreation and leisure helps. getting out into the great outdoors, doing horticulture and kind of outdoor pursuits. So we defined it as creativity, so it gave us a broader scope, a broader kind of range of choices for people, I suppose, really. And again, trying to find something that people could relate to and want to get engaged in, really. We particularly started to attract people who were rejecting traditional medical model. I think the approach is very complementary and supports a medical approach, but certainly some people were not wanting medication or not wanting a full medical approach, and this very much complements it. I suppose part of that culture change, passion and soul, is how we describe our approach. It's tapping into people's passions, and it's certainly food for the soul. And like Penny Braun, certainly it's about restoring hope, meaning and purpose. I think if people have had a long period of mental ill health, then your confidence goes, and restoring that hope, meaning and purpose to people's lives. And Debs is going to talk about that in a second in more detail. A big factor around how we approached this as well was as a community approach. So we wanted to engage with our communities, and we formed partnerships with different creative organisations in our community. That meant that we weren't doing this on our own for a start. We were looking at what skills were out there that could help us to start to deliver more creative type approaches. Our staff were massive in that, lots of skills and kind of creative ideas from our staff, but certainly our communities kind of rose to the challenge. We talk about match funding. That was very important because we kind of started this 5 years ago just as austerity was starting to bite, and match funding was really important. For every £100 that we invested in a project that was creative, our partners matched it with £100, so it doubled the amount of work that we could do, which was important for us, but also in terms of the accounts of the organisation, it kind of appealed, I suppose. This is very much a non-medical approach, and I would say one of the things that's really important is non-judgmental. The health services can kind of appear to be judging people when they're making assessments, and I think this is about being yourself, and again Debs will talk about that in a bit more detail as well. All our partners, they're passionate about this as well, and the warmth and the compassion that comes through when people are passionate, it really makes a difference, and people feel that and live and breathe it. There is a lot of empowerment in how we work with Creative Minds, and we do have peer support, and we have peer-led projects. We've moved beyond that kind of co-production into people actually leading the projects themselves. The peer support's very interesting because it's not peer support around the condition. It's more learning a new song, learning a new chord, playing a new song, that kind of thing. People want to come together to do that kind of thing. If you're having a bad day, people might spend 5 minutes on talking about that, but it's about the passion for the activity and taking your mind off things and getting into a different place. For all those reasons, we kind of call this more of a social movement, and I think if you do things in kind of partnership with communities, that social movement element starts to drive things and people start to come forward. I'll move on to practical kind of tips and in terms of implementing this kind of group activity work. I would say the key one is community ownership. If you get community ownership right, if people feel like they can contribute, people can feel ownership of the approach, and certainly the Creative Minds logo really appealed to people. It wasn't NHS, it felt like something more attractive and more creative that people kind of flocked to. So that community ownership is key. That, in terms of actively seeking out partnerships, people started to come to us with ideas. Recently we had Barnsley Football Club are a partner, and they had a massive archive of the kind of history of Barnsley Football Club, and they came to us and said, we've got this massive archive, it appeals to men, we think that we could do a great project, we want to make the club more dementia friendly, it might be, we could do some reminiscence therapy, but we think if people could keep coming to the club, then in terms of any condition, it'd improve and it would help people to keep healthy longer, really. We said, yeah, we want to work with you. This is where we kind of broker things with the organisation. I think sometimes medical people view it in a different way, and they kind of said, well, what's Barnsley Football Club got to do with health and dementia? But now they love it. We've broken down those barriers, we've changed the culture, and they engage in it really well. Making sure that there's ownership and co-creation and all the projects are interlinked and working with each other. I want to pass on to Debs in a second, but before I finish, I suppose one of the things you were talking about was language, and language is really important to us. Certainly being part of the programme, language has been an issue that people have come up with time and time again, and medical language can be a barrier and can be very off-putting. We really kind of aware of that, and we use much more user-friendly language, I suppose, really, that people are more likely to engage in. And if you're looking for solutions, that kind of using a user-focused, a solution-focused approach, I think it is finding what people are good at. If you can find what somebody's good at, and then that starts to build their self-esteem, that starts to get their kind of hope, meaning, purpose back into their lives, really. So if that's your aim and your mission to kind of engage in that way, it goes a long way. And seamlessly, Debs will start to talk about that as well. And over to Debs.
I've been in the mental health service from being a young child, and you pretty soon learn in that service to shut up and do what you're told. And people tell you how to live your life, and having been in it from being a young child, I accepted and I acknowledged that. I once did speak out, and I was labelled a troublemaker for speaking out. So you pretty soon learn to fit into the continuum of mental health care. And it was 5 years ago, nearly to the day, when I reached crisis point. I'd taken an overdose. I wanted to be with my mum, and that was my focus, to be with my mum. At that particular point in time, I was on 21 tablets a day. I was bedbound quite a lot of the time, and my children were my carers. I felt at that time that my children needed to be set free, that they deserved a better mum, that life would be better for them as well as me. I'd been told by a professional that I would always be ill, I would always be medicated, and I'd never work again. And I believe that professional, because they were the experts, they had the answer to my problems. And that's how I felt at that particular point in time. I was referred through the crisis team to a psychologist, and while I was sat in the waiting room for the psychology appointment, I happened to see a leaflet, Creative Minds Art for Wellbeing. Never done art before, and I still don't know to this day why I picked that leaflet up, but that's the day my life changed. And I started drawing, something which I'd been ridiculed by my children from, because they were horrendous. Then I was one of these people who said I can't draw. And 5 years later, here I am. I've sold 106 paintings to date. I've had an exhibition at Canary Wharf in London. But most importantly, and that's why I've really enjoyed the realising the value, is because my life has changed. I finally got alive. Having been in that system and just been a patient number all my life, it's really good to feel like I'm a whole person, that I've got something that I can contribute and give back to society. And the real value is not the cost to the NHS, which I know is important, but that doesn't really matter to me or you as an individual. But the real value is, like I say, I've sold paintings. I do talks all over the country about my journey and where it's taken me, what's happened, the good, the bad, the ugly. And through one of the talks, I was offered tea with the Queen, which I did turn down because I don't actually drink tea. But the very stern gentleman told me that you don't turn tea with the queen down, so I went along and had apple juice. And it was quite a poignant part, really, because things like that had never happened to me. I was an invisible service user. I was just somebody who was always under the radar, who accepted that's how my life would be. And this gave me confidence. It gave me what I call skills for life. And through the paintings, I wasn't judged. You go to an art class, so you don't put your best clothes on. You go in your scruffs, so it doesn't matter if you're there in your scruffs. Whereas when you go see a psychiatrist, they're judging you. Is your hair clean? How you sat in the waiting room? What you're wearing? How you're interacting with people? So it's something that gave me power to take control and realise just how much my life is worth. And like I say, in these 5 years, so many incredible things. I'm off benefits for the first time in 14 years, and I actually work in the same trust that NHS, a trust that psychiatrist told me that I'd never work again for, which is quite interesting when we pass on the corridor. But to be fair, he is one of our advocates now, and he's completely changed his ways and how he sees and says to people, because I have told him, don't ever say that, it's not right. And I like to think that the psychiatrists and psychologists are now listening, because it's about teamwork. You can go to as many universities, get as many degrees and letters after your name as possible, but that doesn't make you an expert in it. Only by living with that condition 24/7 can you see a different side to that. And if we work together as a team, we can get a better outlook. And I believe that's what we need to do. We need to be working as a team, regardless of what degrees and expertise you've got behind you. If you work with a patient, you will get a better outcome. And that's what has happened to me. My children have seen this change in me, so they've pushed themselves. And a few weeks ago, I watched my daughter graduate, which is absolutely fantastic for any parent. But when your child's put their career on hold, their education on hold to look after mum, that means so much more to now be able to stand there and watch her graduate. And it's just such a wonderful journey that I don't believe it. And people say to me, you know, wow, you've come a long way. And yes, I have. And when they say, the sky's the limit, there is no sky limit. That it keeps going on, this journey is so fantastic. And I want other people to feel and think and be valued. I want people to see that it doesn't end with your mental health, that you can become something, that you can be worthwhile, and you're more than just a number in that system. Thank you.
Thank you, Debs. That was I've heard Debs tell the story before, but it's as powerful every time I hear it. So thank you for sharing it. So we've got a little bit of time for some questions now, and thank you to everyone who's been sending them through. We've got a good selection. We probably won't get to them all. So if you have any questions that we don't get to, then do get in touch with us, and we will answer them after the webinar. So first of all, Debs, you sort of mentioned this a little bit, but somebody's asked around scepticism from doctors and professionals, and how you overcame that as an organisation to sort of win their trust.
I remember at one of the, because with Creative Minds we did a lot of events with service users and staff, and I was sat on the same table as a psychologist. Well, there were two psychologists, but one was quite negative. And she said, we've tried it all before, we've done it, it hasn't worked, which was like a red rag to a bull to me. And I'm so glad we were actually sat on the same table, because I told her that we've got to keep trying. It might not have worked at that particular point in time, but that's not to say it won't work in future. And at the end of it, she did apologise to me, because she did liken me to a little fish in a big pond. And I said, I'll continue to be that little fish in this big pond until I see changes. So yeah, she changed her mind.
And how about from Penny Braun's perspective, have you encountered?
Yeah, and over the years that I've been working at Penny Braun, I often ask people, what if your doctors told you about the things that you can do to help yourself? And I would say that over the last 7 years, I think there's been a real change. There used to be, everybody used to put their hands up and say, I asked, and they said, there's nothing you can do, just take the medicines, come for your follow-up appointments, and that's all. And now I think the tide is turning, and I think it's people who are going back telling their consultants about the things that that have made a difference. There now are exercise programs that are being rolled out across the country specifically for people affected by cancer, to rehabilitate them, to give them back the confidence. And I think, I mean, we've still got a long way to go, but there is a big shift, and cancer's really starting to be seen as a long-term condition where people need to be given the skills and be valued as real experts in what will make a difference for them. So I think it is changing.
I think the goalposts keep changing as well, and they need to keep changing.
Yeah.
We need to never think that we've reached it. We need to keep pushing them boundaries and going further.
And I think there's more little fish in the pool.
Yeah,
you know, I think that, you know, if you're one lonely fish, that's quite a
Yeah.
lonely place. But I think there's more and more people who are now living testament that it makes a difference and that you can't just give up on people. Yeah.
I think the only thing I'd add from a organisational culture point of view, certainly innovation and creativity at all levels is essential, and I mentioned our chief exec, very supportive. One of the things that he got a lot of senior members of staff together when we started this journey and said, we're doing something differently, and I want a can-do attitude from everybody. I don't want people to be told they can't do things, and it's very easy to put up barriers, especially when you're doing things differently that might be more risky. Actually, it's about positive risk taking. So I think if you have senior buy-in and the barriers are removed, you know, the culture starts to change, and people come with solutions again rather than problems, or you can't do that because it's, you know, it's a health and safety issue. Yeah.
And I think what Deb said about learning life skills or skills for life is really important, because I think a lot of healthcare professionals nowadays recognise that they need those skills for themselves. And so actually we've had groups, a whole chemotherapy nursing team came out to learn some of the skills, you know, partly so they can tell their patients about it, but really also for their own resilience as well. So I think that starts a cycle going. And also I think evaluating things and proving that they make a difference, that changes minds too.
Yeah, so interestingly, that sort of maybe touches on the next question, which is really about getting sort of funding. And somebody said or asked about co-production in particular, which you all mentioned. And any tips on justifying the cost of engagement and involving activities? I mean, it seems absolutely vital to me, but is there any sort of tactics that you've used to get those sort of activities funded?
In terms of involving people and the time and the expense of that, maybe for the trusts, but certainly that is a well-used resource, really. I think that understanding what people want and involving them in designing the solutions is time well spent, and you're more likely to get things right if you do that. We've been very lucky that I mentioned earlier the match funding. I think that is important to get, because some of these approaches can be not expensive, but certainly it's getting a lot of people together, and you know, and if you can match that with some community funding, that's helped us to kind of. But the success as well. I think people's stories like Debs, that's how you convince people, I think, really. We do evaluate all our programmes, and they all evaluate very well, but they don't tell that full story in an evaluation. And we are looking at trying to extend that evaluation over a number of months, if not a year, because very often a small programme, it's the next 12 months that we're all the growth. Yeah, so if you can capture some of that, and we are looking with University of Huddersfield to try and capture some of those stories as well, really.
The cost for 1 year's medication, for me, being on 21 tablets a day, it cost less for 2 years at Creative Minds. Yes. So it pays to involve people, it does save money. I mean, that's just medication alone. When they've done a social investment and return on my journey, I've cost the NHS thousands. You know, I mean, I'm talking 10,000 or more just in 1 year on my care. I've been in the system since I was 8 years old, you know, so by involving people, you are saving money.
I'd also, agree in terms of, identifying early symptoms of cancer, especially ovarian cancer, but all kinds of cancer, and recurrent symptoms of current. You actually need to be involving people who have those illnesses, who've got that experience, so that they're passing on that information to other people. And that's one side of it. Obviously, you need GPs to be picking that up as well, and health professionals or consultants to be listening to the patient. But actually, patients can also, get more empowered as well, just by networking with other people and reading about other people's stories or speaking to them.
Quite funny what you say, because I started doing the talks initially for service users because I felt there was no hope in the system. And I started talking to service users, and then the experts were asking me, actually, can you come and do a talk at our event? So they did start listening and realising that there is some resource there that they need to tap into.
So it's really interesting, because somebody's asked around sort of suggesting that maybe in mental health and community settings that this is more common, but still much less common in acute hospitals where care is more physically focused, and questioning whether clinical training is actually part of the problem. So interesting that you mentioned that staff themselves don't have these skills, and that looking to people like you, Debs, to give that.
Yeah, and I think it's changing, and I think medical education is changing, nursing education is changing, and I think resilience building skills, really those kind of engagement skills are really valued alongside the sort of more technical scientific skills, because I think it really. The nice thing is that all of this sort of, we've been talking about two very different illnesses, cancer and mental health problems, but you could probably have a cardiologist here and, a diabetologist as well. And some of the big problems that are really facing our society can all be helped with very similar things. And so when we give advice about healthy eating to somebody affected by cancer, actually, they're going to, if they make those changes, that will help with their weight management, help with their sort of cardiovascular and risk of heart disease and strokes. It will help them keep their joints healthy, and actually the savings start to sort of really stack up. So I think the work that the Health Foundation has done in trying to kind of quantify some of that, because as part of the Realising the Value output has been a kind of tool to try and actually use the data from the 5 pilot sites to actually sort of almost put a price on some of this, which has been quite incredible, some of the figures they've come up with. And obviously the science is at an early stage of development, but I think that will help. But I think the trouble is that the savings are a bit further down the line, aren't they? And everybody needs to spend their budget and see the wins this year.
One of the programmes that's probably been most successful for us, we run something called a Good Mood Football League, where our staff and service users, carers, play in the same teams, really. And again, that's a great leveller. That changes the dynamics between professional and the person who's... And very often, if a member of staff wants to have a cigarette, they're kind of... Some of the service users like smoking. And that... It just changes the dynamics, and actually they're healthier, everybody's healthier, relationships are better. Our chief exec is playing in the next Good Mood League in a few weeks, next week I think it is. Again, that's a great leveller. It just changes the dynamic, it changes the culture. How we build that into nurse training, I'm not quite sure.
We have done some talks though in universities, haven't we, to nurses and social workers and psychologists. So they are sort of listening and seeing that there is
I think a younger
a need
generation
there.
coming through for whom it is a much
really important,
more sort of convincing sort of thing. It fits with the way they're looking after themselves.
They're much fitter for playing football.
We've got a choir, which is staff and volunteers as well, because a lot of this, I think, when you mobilise patients, you mobilise communities, you start to find that there are a lot of people who will contribute, who want to contribute and want to give back something to the system. So again, that's an untapped resource until you plug into these things.
Yeah, I found out what a 3-part harmony was one of our choirs, which is quite a revelation to me.
Yeah, absolutely. The role of communities is essential to this as well. So I'm just conscious of time. I think we could keep talking for ages about this, but we'll draw it to a close now, I think. And as I said, if anybody's got other questions that they are still really keen to get an answer to, do get in touch, because we're continuing to do lots of work in this area and keeping in close relationship with Creative Minds and Penny Braun. So we're really happy to try and answer those questions outside of this. So I think just a big thank you to the panellists today. Thank you for giving your time and sharing your stories. It's been really wonderful. Thank you to everyone who's watched and submitted questions. I think it's been a really interesting discussion, and yeah, and it's such a, I think so clearly it's such an important area to be focusing on, and it really feels like there's a groundswell of people being interested in this, and of it sort of becoming more and more important as we talked in education and in other aspects as well. So exciting to be talking about it. All of the resources are on the website, so do take a look. There's lots of detail there. And also please do look out for any for future Health Foundation webinars, because there's always lots of interesting topics that we're happy to cover. So thank you and goodbye.
Thank you.